Hello everyone, welcome to the lecture 26 of climate change extreme events. In the previous lecture, lecture 25, we have discussed about the socio-economic impacts of climate change and extreme events. We have discussed in a detail about what is the immediate impact of socio-economic conditions because of particular extreme events and what is the delayed responses. Immediate effect, infrastructure loss, crop yield, and then basically let us say exposure to the population to particular extreme events. And then delayed response, for example, there are several migrations or drop of the socio-economic productivity or basically indirect effect of these extreme events on different types of economical activities. So, we have discussed about all these things in the previous lecture. Now, another important point about climate extremes is what is the climate extreme effects on, let us say, health and social impacts. So, in this lecture we will talk about this particular topic. So, in this particular lecture we will explore the health consequences of extreme climatic events. We will analyze the social and physiological impacts of climate extremes. We will discuss about some case studies which are illustrating the human impacts caused by extreme events in terms of social and health impact. And then we will also, towards the end of this lecture, we will discuss about the strategies for mitigating health and social risks, so that we can have a better plan learning from our previous case studies or previous climate extreme events like that. So, when you are talking about climate change, indirectly you are referring to state of the change of the climatic system, particularly influenced by human activities in terms of greenhouse gas emissions. When you are talking about climate change resulted into several different types of forms or extremes. For example, floods, droughts and heat waves and etc., cyclones, and that has a very direct impact on direct and indirect impact on social or health of a particular society or region. For example, it depends upon the vulnerability factors. So, the location where these kind of extreme events are happening, what is the demography, what is the geographical region, what is the biological factor, health status, etc., what is the socio-political status, what is the socio-economic conditions of that particular region, what is the health system capacity, and what is the gender inequality among all these gender equality like that. What are the climate related hazards? For example, there are several types of extreme weather events, heat events. If the, let us say, community or that particular region are situated close to the sea level, then the sea level rise might be a significant problem, can pose. Air pollution, vector borne diseases or ecological conditions, water scarcity is another big problem, and the reduced food productions because of the low availability of water, frequent flooding, frequent drought, frequent heat waves like that. What is the exposure of this? Suppose in that particular region people and communities are not very much aware about the extreme events or their frequencies or sort of understanding of these climate phenomena. Health workforce, what is the, these are the health workforce which can be exposed. Infrastructure, which we have already covered in the previous lectures, that infrastructures can be significantly damaged because all these different extreme phenomena. Energy system, energy supply system, power system, power outages we have also talked about. Water systems, food system and health system, these are the sectors, these are the areas which can be or potentially be exposed if some climate extremes hazards will occur in a certain regions like that. What would be the health outcome? That could be a very fatal extreme events conditions or heat related illness, respiratory issues, waterborne diseases or vector borne diseases or malnutritions or some sort of NCDs or mental and psychological health, which is post syndrome or post trauma syndrome, we can also say. So these are the some of the outcomes which emerged from these kind of the extreme events which are happening in a certain locations, and that is basically a very serious issue when it is still unnoticed or not planned properly in a certain regions like that. How do we enhance, how do we control these, particularly if we have impacts on healthcare facilities, or if we have better healthcare system which is least susceptible to some sort of exposure to these extreme events, then we can basically provide better services, or health system overall we have to improve like that. What is the health impact of overall climate extremes? When you are talking about climate change and extreme events, particularly we are talking about increasing greenhouse gases, rising temperature, extreme weather events, or rising sea levels. So that is basically can increase the chances of air pollution, increasing allergies, which is converted to several different types of respiratory or type diseases, cardiovascular diseases like that. Then it can be also be possible that the extreme heat conditions can also be resulted into heat related illness or very fatal conditions like that. A drought basically can generate the water supply impacts or water availability issues, and in some areas it can also be responsible for dust storms or several types of communicated diseases like that. Environmental degradation because of all of these extreme events can be forced migrations, can be civil conflict as well, and because of this loss of jobs and incomes, social conditions, socioeconomic conditions can be significantly affected by these types of extreme events like that. For example, if you talk about wildfires, wildfire smokes or like these are basically can be very injurious or impactful for cardiovascular or respiratory diseases like that. If you are talking about degraded living conditions and social inequalities, which can also be responsible exacerbating all these health impacts because of the climate extremes. Changes in the vector ecology, several types of viral diseases which can also be more communicable or more favorable in that particular scenarios like that. Food system impacts, basically let us say if you have drought or floods or many other extreme events that can directly impact your crop yield. If we are not prepared enough to tackle that particular type of climate extremes, then there will be a shortage of foods that would result into malnutrition or food insecurity or higher food prices or foodborne diseases like that. Severe weather and floods events which can be can basically initiate kind of injuries or multiple different types of disorders like that. So there are variety of problems which can be directly or indirectly linked to the impact of climate change on social or health system across different parts of the world. So what is the social and physiological consequences? Let us say if you are talking about any climate extremes, that has a very significant impact of those areas which are overcrowded, and if there is overcrowded, there are high chances that there will be a higher exposure to that climate extremes into that particular region. Or it could be forced migrations of the people from one place to the another place, for example, for better livings or for more income. They go to that particular cities or areas where we have more income, but unfortunately they are exposed to these kind of climate disasters in that particular regions because of unsustainable growth, unsustainable management, unsustainable settlements of those the migrated peoples like that. Home destructions in another phenomena which we have very common, we have observed during the floods events or near to the river bank channels like that. If you remember that we have talked about in a very detailed manner Kedarnath valley destruction because of the flooding which occurred in 2013, and most of the buildings which were very close to the river channel were damaged. So, home destruction is another social impact which is directly impacted by high intensity extreme events conditions. Displacement is another issue, basically forced migrations, living from one place to another place. Let us say some region has significantly dropped the economical or the economical conditions because of multiple factors. It could be agricultural linked as well, or in the previous lecture we had talked about Thailand. So, there is a loss of productions of certain certain materials or certain objects which can be exported to many other countries like that. So, for example, that might also be possible that there is a loss of those jobs in there, and that could directly impact on the social economical conditions of that particular locations, and that can initiate this displacement issue in migrations, moving from some different areas like that. So, these are some of the social impacts which are caused by extreme events. There is a social inequality and vulnerability. For example, rural areas with good infrastructure, or some other areas we do not have a proper infrastructure like that. Low income urban neighborhood, or some sort of minority population which are living very close to the flood prone region, or they are not informed about the local authorities like that, or informal settlement with the community support which is not sustainable. So, these are some of the social inequality which can also plays a very significant role on initiating or compounding the impact of climate extremes in a certain regions like that. There is another very important issue which is created by these extreme events, that is PTSD, post trauma syndrome, or disaster syndrome like that, which is basically happens for example, loss of infrastructure or loss of productivity or loss of job or socioeconomic conditions that can indirectly affect the living beings of certain areas, and that is basically people are suffering with these kind of the mental health issues there. Anxiety is another big problem because of these climate linked disasters. Heat events, cold events can propagate that effect more in a certain regions like that. Depression is another problem, repeated trauma or because of the climate extremes, or long term trauma, for example, societal damage, or let us say mental health challenges, or let us say so area is frequently affected by a particular kind of a disaster, and therefore it has been lost complete the socioeconomic conditions like that. That is a long term effect on that particular region. So, mental health issue is also a very important topic when we are covering our social and health issues in a certain regions like that. So, now we will talk about some of the case studies of let us say what is their impact on social and health care around the globe. For example, case study 1 is 2003 European heat waves. Here we talked about this particular events were occurring in 2003, and it created very high temperature, duration, and that is because of this basically a large population of Europe has been vulnerable, exposed to these kind of heat waves. So, what were the health impacts? It has been noticed that increased occurrences of cardiovascular diseases, issues, respiratory problems, and vulnerable groups which are elderly or children or illness faced highest mortality individuals like that. That has been gone up. So, these are the some of the health impacts we have observed. So, these types of extreme events not only reveal the impact, frequency, occurrences or regional coverage, it also gives you a very clear insight about if the similar kind of the extreme events will occur in a certain region, what could be the potential people who are going to be affected by certain extreme event conditions. So, we have to be little bit more prepared to at least save them if any these kind of catastrophe will occur in certain regions. What are the lessons we have learned? So, basically we can talk about early warning system, of course, that will predict beforehand if a certain heat wave event or any climate extreme events is likely to occur in a certain regions, or what is the probability of that occurrences. What are the public health planning, overall medical facilities, how quick our response would be if any catastrophe will occur in a certain region. What are their overall health preparation in a certain regions like that. Targeted support vulnerable populations if we have identified or not, and what is the overall improvement of a health system in a certain regions. Urban design resilience is another issue, because another area where we can improve, that designing the urban environmental to mitigate their heat effect, particularly heat waves. We have to plan the urban infrastructure in such a way that the effect of heat wave should be minimized, or we can look back to our traditional things or traditional methods where we are building the certain infrastructures like that, so that we can minimize that effect of heat wave in a certain regions like that. And then overall communities and awareness of a certain regions. We have to aware the public about the negative impact of heat wave. We have to educate the public about the heat risk, the risk associated with the climate extremes, and what could be our basic preventive measures. Because if they know that, let us suppose in a certain region floods occurs very frequently, if we just go to that place and aware that public what we should do and what we should not do in a certain regions like that, where we should live, or if we are living very close to the river channel, what kind of the preventive measures we should think about it when we are living in close to channels like that. Or let us say if you talking about geophysical or geo hazards, let us say earthquake, if we are basically awareing the public about what we should do during the earthquake and what kind of the facilities or activities we should not do during the earthquake if it is happening. If you start raising these awareness program from the beginning of children growth or to the communities, that really helps a lot, and to aware the public about the severity of the problem in a certain regions like that. That is another case study of 2010 Pakistan floods, where during July 2010 there is a very intense amount of rainfall we observed. In September 2010 the rivers become over flooded, flooding begins, and then September 2010 there is a very severe situations we have seen. 1/5 of Pakistan was submerged because of the flooding event. That was the gravity of that particular problem. In September 2010, over 20 million people affected. Some of them has been lost their life, migrated from one place to the another place, lost their jobs, complete breakdown of the socio-economic conditions in certain parts of the Pakistan regions like that. So, what is the takeaways of these particular event is that we should have a emergency planning, emergency food, water, medical supports. We should have a infrastructure rebuilding so that we can, or infrastructural susceptibility, resilient infrastructure system, or challenges in the long term recovery, we should know about that. So, these are some of the response and recovery we should know in order to tackle similar kind of events, not only the Pakistan, but some other regions, India or some neighboring countries as well. What is the overall consequences of this Pakistan flood was, flooding occurs, there was a water source contamination which also occurs indirect, and there is an outbreak of disease, vector borne, waterborne diseases, and therefore a lot of people has been displaced because of these the continuous the still water in certain region that initiates the outbreaks of several diseases. And there is overcrowded camps, refugee camps, migrated people has been living somewhere else which was not their native place in a camps or regions, and that is also they have increased their exposure to further kind of extreme events like that. And there was a limited access to resources, that is basically overall social and economical strain. So, that is kind of a cyclic impact. One problem is started and that basically incited the other different problems, and that is the whole problem has been compounded in such a way that it will become a very big problem for a very long period of time. So, that is the case study which we we can think, we can learn from these case studies, and we can think about what kind of the preventive measures we should think when we are talking about these kind of climate extremes events like that. If you talk about globally, the food and water is one of the primary key issues which are important for every aspects of life, and if these two things are affected by any certain climate extremes, that we basically say that these peoples or these societies are very much exposed to climate disasters or climate extreme events like that. For example, if we have a very low amount of water availability, then in that conditions, let us say if the drought event occurs, we will not be able to manage the fresh water availability to the people who are living that particular region. So, that will basically incite another types of problems or create another problems in that region. So, that is basically, if you look at the map of the world, here it shows that there are the regions where we have a very higher food insecurity, very moderate food or low food insecurity like that. There are several regions which basically shows that how we can look at these food and water security across different parts of the world. For example, if you talk about selected food insecure hotspots, Mali, Central America, Africa, Republic conflict region, Malawi or Zimbabwe or South Sudan or Syria, Afghanistan, Philippines. These are the regions which are actually highly affected by these food insecurities, or these are the hotspots like that. So, if any particular type of drought will occur, that will reduce the water availability, that will further reduce the crop yield, poor crop yield will be there, that will further increase the food prices, inflation there, food shortage will begin, and that will basically create the malnutrition, and that will basically further increase the disease vulnerability of that particular society, and there is a dependence aid. So, this is a cyclic behavior. If one particular problem starts, if you do not have any solutions for that, that will create further propagation effect on a particular societies like that. So, what is the water? For example, further example is when we are talking about water contamination, there is a disease outbreak, and there is a disrupted water distribution and long term health risk of that particular societies. So, this is what basically tells about how we should know about the food and water hotspot region, what is the appropriate level of the food and water level we should have in a certain region. At the same time, we should also know about what is the population count in a certain region, so that we can balance the food and water availability of that particular regions among all the people which are living into that particular regions like that. There is another example, climate extreme impact on child nutrition growth. Here it says that when you are talking about the climate extremes, it can also be very harmful to the children if they are falling into that particular hotspot region where we have low availability of water, low availability of food, water like that. That is basically the growth development. There is a lower the cognitive impacts, cognitive performances like that. There is a health risk, and there is overall the economic burden of those people there in the societies. What are the strategies for reducing health and social risk? We have to talk about early warning system, we have to talk about heat alerts, flood alerts, drought alerts like that, and then we can basically look at the disease surveillance. What kind of the climate extremes are responsible for malaria outbreak, for example, or different types of pandemic, or different types of epidemic in a certain regions like that. Then we have to talk about healthcare adaptation measures, because we should have an emergency response plan, we should have a hospital which should be always in a prepared mode, and then we should have also the mobile healthcare units which can reach out to that location which are unreachable during some certain of duration of the climate extreme events. So overall, community resilience program should be the must is important, and that is basically can improve the health and social risk, decrease the social risk of a certain locations like that. How we can improve that? We can launch several public awareness campaign programs. We can talk about local disaster preparedness. We can talk about community based disaster risk management. We can talk about strengthening the social networks. We can talk about infrastructure resilience. So these are the some of the key important factors which are responsible to improve the health and social risk of climate extremes in a certain locations like that. So in order to build all these climate resilience program, we should have a very important role of the local government and organizers. That basically they define the policies, they implement that policy in a certain region so that people should obey, should follow that rules, and therefore that policy will be implemented, and that make sure that the impact of the climate extreme should be minimized in that certain regions. So that is the national adaptation plan, health policies and disaster risk reduction. So basically we talk about DRRs, where we are basically looking at minimizing the disaster risk and impacts like that. There are also important role of non-governmental organization, NGOs and WHOs in climate resilience. For example, climate extremes happening, there are Red Cross disaster relief, there are WHO disease, and that is basically also provide some sort of different types of NGOs which basically also provide some sort of necessary services during that climate extreme disasters like that. There is another important role of global bodies, for example UN, United Nations, Sustainable Development Goals and Climate Resilience, that develops several SDGs or the development goals, where they are talking about several different types of actions. For example, if you are talking about SDG 3, that is the good health and well-being, strengthening the health system, address the health threats. If you are talking about SDG 6, that is talking about the clean water and sanitation, which provide clear water, ensure sanitations like that. If you are talking about SDG sustainable cities and communities, that is basically advocate the improve infrastructure and disaster preparedness. If you talk about SDG 13, that is basically climate actions, that is basically talking about primarily the reduction of the emission greenhouse gases and enhance resilience. You can further read about these different SDGs in detail, so that you can know about what are their different goals which are set up by United Nations for different countries, so that they can follow all these paths like that. Then what is the future risk and long term adaptation? Future climate change is likely to happen, and that basically intensify the climate extremes across whole world. Their frequency, magnitude, severity will increase. That is basically can create multiple heat waves, flooding and coastal disasters, droughts and wildfires. That is basically create multiple different health and social issues like that. How do we tackle them? We can talk about some sort of mitigation and adaptation planning, green infrastructure, flood resilience infrastructure, heat resistant materials or climate smart transportation. There are some of the ways which we can think about it, and we can implement it in our society, so that we can mitigate the effect of climate in a certain different parts of the world like that. We can also strengthening the available or present infrastructure, expanding the coverage of, let's say, healthcare or several essential services. We can workforce development, we can training of the healthcare. Let's say if any extreme catastrophic events will occur, how they will tackle, what is their role, how they will behave overall, behave in the sense that how they manage the overcrowded patients in that particular period like that. And overall, what is the health education? It is not only the health education which we are talking about, doctors, professionals like that, but it is also about the community awareness. Okay. So, for example, we can also talk about what is the outbreak, how different types of diseases will work, and how we can make a preventive measures to stop those outbreaks, or basically can take at least some steps so that the overall impact of certain disaster will further reduce like that. That is basically overall improvement of the public health investment, or the public health in a certain regions like that. So, in this particular lecture we have primarily covered climate extremes and their significant role in health and social consequences. We have also talked about vulnerable populations and their disproportionality affected by several different types of climate extremes. Then we have, based on the case studies, we have talked about what are their proactive planning and resilience measures we can take, or let us say what is the role of local governance, what is the role of NGOs, what are the goals which are set up by United Nations. We can learn, we can think about it, and we can adopt in our social system, so at least reduce the risk of disaster in that particular regions like that. So, in the next lecture we will primarily talk about vulnerability in adaptation in developing regions. We talk about what kind of the vulnerable and adaptation measures we will take in the developing regions like that, which are highly exposed to the extreme events like that. Thank you so much for your attention.